Welcome everybody. Let's go ahead and get started here. My name is Avery Gable with Medicare Campus, and a little bit about who we are. So Medicare Campus is an educational division of Knox Newmas, and we provide Medicare and retirement education to communities across the Midwest. We're based out of Wichita, Kansas, but we help people all across the United States. We're licensed in most of the surrounding states around Kansas as well, and we found that many people are happy with conducting business over Zoom or over the phone now. So just know if you're not where we are that we can still help you. But we are independent of Medicare or any other government organization, so we're not associated or sponsored by Medicare or any other part of the government. We do have 23 advisors and support staff, including myself, and we've been around for a while. We've been helping people on Medicare since the Medicare Prescription Drug Improvement and Modernization Act of 2003, which actually established Medicare Part D as in drug starting in 2006. So a little bit of an agenda of what we'll cover is how Medicare works. So hopefully it's not alphabet soup by the time we're done with it, but we'll talk about Parts A, B, C, and D. Then we'll also talk about important enrollment deadlines, Medicare versus group insurance, and how to compare those and what to do if you're in that scenario. Also when and how to enroll. We will also compare original Medicare versus Medicare Advantage plans and stick to unbiased facts. Also how to avoid penalties. You'll see as we go through that if you don't make elections during your time periods, then you can be penalized. We'll also talk about some mistakes to avoid and prescription drug plan options. So we'll start off with what is Medicare. So Medicare is a federal health insurance program for U.S. citizens and legal residents, and it's funded by you and me and everybody else that is working and paying Medicare or FICA taxes. And something key to remember about Medicare is it is individual health insurance. So if you're married, you will have your own Medicare card and your spouse will have their own completely separate Medicare card. It's not like your group health plan that you may have through work where it's a family plan and covers everybody. Everybody will have their own Medicare number and their own Medicare secondary insurances, whether that's a supplement and drug plan or Advantage plan. But Medicare is not free. As you'll see as we go through the presentation today, Medicare is definitely not free. We already talked about it's not a family health plan. Medicare is not Social Security. And Medicare is not Medicaid. So Medicaid is income-based and is administered by the states, where Medicare is generally age-based. Once you're 65 or older, you're eligible for Medicare. But Medicare does not take income into account on whether or not you're eligible for it. And it really comes down to you have two options when getting your Medicare benefits. And option one is known as original Medicare with a Medicare supplement. And you would have Medicare Part A and Part B provided by the federal government, and that would help pay for hospital stays and doctor's visits or anything else that's outpatient. And then you would also have a Medicare supplement that would come in and pick up the things that Medicare A and B do not cover. And then you would also have a completely separate prescription drug plan. So option one, you'd have three separate cards. You'd have original Medicare A and B, a Medicare supplement through a private insurance company, and then also a prescription drug plan through a private insurance company. And we're going to go into more detail on these options in the later slides, so this is just kind of a high-level overview. Then the second option, you would still have Medicare Part A and Part B, but you would have a Medicare Advantage plan is option two. And the Advantage plans combine everything. So it's your medical, drug, typically the drugs are included, all lumped into one plan. And typically the Advantage plans are either low premium or zero premium, and they include some extras or additional benefits that may not be included with original Medicare, like dental, vision, or hearing. But as we go on, and you'll see, the Advantage plans are either HMOs or PPOs, so there's a network of doctors that you have to stay within. There are differences between these two options, so here in a few slides we'll dive into the weeds a little bit deeper and explore those. So going back to option one, the first thing you would have is original Medicare Part A and Part B from the federal government. And Part A is your hospital insurance if you're formally admitted to the hospital, and it covers everything associated with your inpatient stay. Now, it doesn't cover everything, or 100% of it, but Part A would cover your hospital stays, hospital room and meals, prescription drugs and supplies used during your inpatient stay, also lab tests or operating room, anything else associated with your inpatient stay. And then Medicare Part A also covers skilled nursing and hospice. But most claims fall under Medicare Part B. So Part B claims would be doctor's visits, ER visits, outpatient physical therapy, mental health, durable medical equipment, chemotherapy. You can even be in the hospital for a couple days, and that still goes under Medicare Part B because you're not formally admitted to the hospital. So those claims would also fall under Medicare Part B. And just a note, prescriptions that you get outside of the hospital are not covered by Medicare Part A or Part B, and you would need to have a separate prescription drug plan for that. So getting to how much does Medicare cost, Part A of Medicare for most people is zero monthly premium. If you or your spouse have worked for 10 years and paid your Medicare taxes or your FICA taxes, then Medicare Part A is no cost or zero premium. Now, Part B of Medicare does have a premium associated with it, and for 2025, that premium is $185 per month. And that goes up each year with the cost of living adjustments on Social Security. In 2024, it was $174.70 per month. So that'll go up a little bit each year, but for 2025, the standard premium is $185. And the Part B premium is based on your modified adjusted gross income from 2 years ago. So the 2025 premium is based on your modified adjusted gross income in 2023. And if your income is higher, you could potentially pay a higher Part B premium that's based on your income from 2 years previous. But the standard premium is $185 per month. And now switching gears to kind of the enrollment periods or when to enroll. And when you first turn 65, it's known as your initial enrollment period, and it revolves around your birthday month. So you have the 3 months before your birthday month, and then the 3 months after your birthday month. It's ideal to enroll in the 3 months before your birthday month. And if you do, coverage will start the first of your birthday month. So even if your birthday is May 13th or May 28th or May 20th, your Medicare coverage will start on the first of your birthday month or May 1st. The only exception there is if your birthday is on the first of a month, your coverage would actually start the month prior. So if your birthday was May 1st, your Part A and Part B coverage would start April 1st. And if you enroll in the 3 months in your birthday month or the 3 months after, it just starts the month following. So if you enrolled here, it would start the first of the following month. And Medicare, you're also eligible for Medicare if you've been on Social Security disability for 2 years or have end-stage renal disease or ALS. But generally speaking, Medicare is 65 or older. And this is a huge question that we get and we help people walk through all the time is, I'm planning to still work past 65. What do I do? Do I stay on my group plan? Do I go to Medicare? Do I do a combination of both? And that's where we come in, and it's really a case-by-case scenario, and you have a few different options when it comes to group insurance and Medicare. So they can work together, and like I said, there's options. So the first option, and this would apply to people who work for a small company with less than 20 enrollees, or this is for somebody that we sat down and we compared your max out-of-pocket, your deductible, your coverages, your co-pays, your dental, vision, hearing, your network on your group plan, and compared it to Medicare, and Medicare was the more cost-effective or the better coverage route for you. Then you would want to enroll in A and B on your 65th birthday or when you're first eligible, leaving your group behind and transitioning fully to Medicare. And like I said, that would be for people who work for a small employer or that it made financial or coverage sense for them to transition to Medicare. And the reason I say a small employer is Medicare deems whether or not your group coverage is quote-unquote credible to Medicare. If you work for a large employer, 20 enrollees on the group plan or more, you have the choice, if your coverage is credible, to stay on your group plan or transition to Medicare. If you work for a smaller company with less than 20 enrollees or your coverage is not credible to Medicare, then you want to enroll in Medicare Part A and Part B when you're first eligible to avoid any penalties later down the road. Then the second option would be to enroll in Medicare Part A only and delay Part B until you retire. And the reason that you would want to do this is, remember, Part A is no cost, so you wouldn't have to pay anything monthly for it, and it would serve as secondary insurance to your group plan. In certain circumstances, this can make sense. It really just depends on what your group plan looks like and whether or not it makes sense to do that. The only caveat is if you enroll in any part of Medicare, you can no longer contribute to an HSA. So if you do have a high deductible plan and have an HSA, you do not want to enroll in, and you're going to stay on your group plan, you do not want to enroll in Part A. You would want to defer Part A because you wouldn't be able, or you would be penalized for making contributions to the HSA. And then the third option, this would be for people who their group plan is great coverage, it's more cost effective, better coverage than Medicare, or maybe their employer pays 100% of their premium, so it makes sense for them to stay on their group plan. So in that case, you would want to delay both Medicare Part A and Part B, and you will not be penalized as long as you've had credible coverage through your employer or through your work or your spouse's employer. That's the next thing here, that if it's your spouse, the same exact rules apply on whether or not the coverage is credible and whether or not they have 20 enrollees on the plan or not. So this is something that we can help hop on a Zoom or get on the phone or get together in person and compare your group plan to Medicare and make the decision whether you should go to Medicare, stay on the group plan, or enroll in Part A only. So now we'll talk about how to enroll in Medicare Part A and Part B, because the first step in any of this is to enroll in A and B and get your red, white, and blue Medicare card. Once you have that Medicare card, we can then go choose your secondary insurances and get all of those enrollments done. But if you're currently receiving Social Security benefits, then you're automatically enrolled into Medicare. So you're going to get magically a red, white, and blue Medicare card will appear in your mailbox 2 to 3 months before your birthday month. And then that Part B premium, $185 a month for this year, will automatically be taken out of your Social Security. So a lot of people forget about the Part B premium or don't even realize that they're paying for it just because it's out of sight, out of mind, and taken out of Social Security before you receive it. If you're not on Social Security, you have to manually enroll in both Medicare Part A and Part B or Original Medicare. And this is something that we can help you out with or assist a little bit with. You can do it online at ssa.gov. If you have an online account there, you can go do it. It's a 5 or 10 minute application process. You can also do it over the phone. If you call them on the phone, they will not do the application right then. They'll schedule a time for somebody else to call you back. And then you can also go in person to your local Social Security office and do it there. And for certain people, there's paperwork that can be done. If you have Part A only already, there's a simple couple pages that can be filled out to enroll in Medicare Part B. And the Part B premium, if you're not on Social Security yet, will be billed quarterly. So you're going to get an invoice, a paper invoice from the government every 3 months for $555. And you can write a check for that every 3 months, or you can go to Medicare.gov and pay it manually each month, or you can go to Medicare.gov and set up what they call Medicare Easy Pay, where they just automatically take that $185 out of your bank account. So Medicare does not cover everything. Part A does a really good job of covering you, and you could probably get by with having Part A only. And the reason is, you can see if you're in the hospital for less than 60 days, so let's say you're in the hospital for 30 days, it's probably at least $1 million or $2 million bill, and Medicare Part A pays for everything except for a $1,676 deductible. And like I said, that's not bad, considering if you have a $2 million bill and you're only on the hook for a $1,600 deductible, that's not horrible. Now, if you're there longer than 60 days, you have a coinsurance or a copay for days 61 through 90 of $419 per day. And if you're there longer than 90 days, days 91 and on is $838 per day. And then also the first 20 days of skilled nursing is covered 100% by Medicare, but days 21 through 100 are $209.50 per day that you would be responsible for. So Part A definitely does not cover everything, but like I said, it's really good coverage with that hospitalization coverage. Now, most claims fall under Medicare Part B, and the way that Part B operates is there's a small calendar year deductible, which is $257 for 2025. After that deductible, Medicare pays 80%, and you're responsible for 20%. The problem is, and this is why most people choose to get a Medicare supplement or a Medicare Advantage plan, is because that 20% has no max out of pocket on it. If you have $1 million bill, or if you have chemo treatment, or if you have an expensive surgery, you pay 20% of that up to no maximum. The other thing is, some doctors do not accept Medicare assignment, or they don't like how much Medicare pays them, because Medicare pays them pennies on the dollar compared to traditional under 65 insurance. So there's some doctors that don't accept Medicare assignment, and if that's the case, they can either charge you 15% of the Medicare allowed amount, or they can write that off on their taxes. So if they would elect to charge you that, you could be charged 15% on top of the 20%, but that 15% is based on the Medicare allowed amount. But the major exposure here is the 20% up to no maximum. So some points about Original Medicare, things to remember. Part A is no cost for most people. The standard premium for Part B is $185 per month, and it's adjusted based on income. You cannot be denied coverage. So there is no health questions for Medicare Part A or Medicare Part B. Now, you must enroll during your initial enrollment period, that 7-month window around your birthday month, or a special enrollment period like leaving your group coverage or retiring. And coverage, like we talked about, there's gaps. It doesn't cover everything, and there are out-of-pocket expenses when using Medicare Part A and Part B without a supplement. And like we talked about, there's no cap on that 20%, and Medicare Part A and Part B does not cover any prescriptions that you would fill at the pharmacy. And special note, not enrolling at the right time can cause a long gap in coverage and a lifelong penalty. So if you don't enroll in Medicare Part B when you're first eligible, it's a 10% penalty for the rest of your life. So you would pay an additional 10% on the $185 for each 12-month period that you go without having Part B that you should have. So it's important to enroll when you're first eligible. And now let's go through your options for filling those gaps. Like we talked about, it really comes down to two options, either original Medicare with a Medicare supplement and drug plan or a Medicare Advantage plan. So if we look at option one, we already went through Medicare Part A and Part B. Like we talked about, Part A has that deductible, Part B has that 20% up to no maximum. And then with original Medicare, you would also need a Medicare supplement plan, which comes in and helps pick up what Medicare Part A and Part B does not cover. And the supplements are offered by private insurance companies, and all of the plans are standardized and have to follow this chart. So over here on this Medigap benefit column, this is everything that Medicare Part A and Part B does not cover. So you can see here's the Part A deductible, that $1,600 deductible. There's the Part B deductible, the $257. There's the Part B excess charge, or the 15%. And then up here is the Part B coinsurance, or that's the 20% that Medicare does not cover. And then up here are all of your supplement plans, plans A through N. And Plan F used to be the most popular plan. Nowadays, the most popular plan is Plan G. They got rid of Plan F for new enrollees to Medicare. So if your Part A date on your Medicare card is before 2020, you can enroll into Plan F and you can keep it, you're grandfathered in. But if your Part A date is after 2020 on your Medicare card, you cannot enroll into Plan F or Plan C. And you can see why Plan F was the most popular plan. It covered absolutely everything that Medicare didn't, except for foreign travel. So it didn't matter what you went to the doctor for, what surgery you had, what test, it was 100% covered between Medicare and your Medicare supplement Plan F. Well, there was lots of fraud, waste, and abuse that was going on, so that's why they got rid of Plan F and Plan C. And now the most popular plan is Plan G, and you can see that Plan G is identical to Plan F, except for that Part B deductible, which for 2025 is $257. So you would pay a premium to an insurance company in exchange for Plan G, and in exchange for that premium that you're paying them, they would cover everything that Medicare doesn't after you pay the first $257. So you pay the first $257 deductible, and then after that, you're 100% covered the rest of the year on the medical side. And like I said, all of the supplements are standardized. So a Plan G with ABC Company is 100% identical to a Plan G with XYZ Company. And a lot of people ask, well, why is this company $20 or $30 a month more than this company? And the reason is, I tell people that insurance companies do not pay claims. They process claims for a profit. So if this company has a group of people, and that group of people has a high utilization rate, they're unhealthy and they use the insurance a lot, the insurance company the next year is going to have to raise the rates on that group of people more than this other company that maybe had a more healthy set or group of people, and this company over here doesn't have to raise rates as much. Well, after 3, 4, 5 years, that can be a $30, $40, $50, $60 a month difference between one company and another, just based on the group that they have. Because when you first turn 65 or when you first come on to Medicare, you can pick any of these supplement companies with no health questions, no pre-existing conditions, no issues. But after 6 months from your Medicare Part B start date, to get a Medicare supplement or switch to a different Medicare supplement, you do have to answer health questions and prove that you're healthy. So it's important when you first turn 65 to pick a stable company and pick the right company, because if you have health conditions, you may be stuck with that company if you're not able to answer the health questions to switch. And your rate when you first sign up will be locked in for 12 months. But after that 12-month period, you're going to get a lovely letter in the mail saying, hey, we're going up. And that's based on your age and claims. And it's not your claims, it's claims of everybody that's at that company. They cannot single you out if you cause them a lot of bills. And that's a main reason why we're independent, is we don't necessarily care what company it says on your ID card. We just care that it says Plan G. Because all Plan Gs will pay according to this chart and be, 100% identical. The only thing that will vary from company to company is how much you pay for it and the customer service that you get. And if you go through us, the customer service point really isn't an issue. If you have something come up or a question, reach out to our office rather than the insurance company and press 1 for English and go through the prompts. Reach out to us. We have a back office team that can help get ID cards or a claim issue or help answer questions. So really the only thing that varies from company to company is how much you pay for it. So some points to remember about Medicare supplements. Like I said, you have a 6-month period to pick any of those plans with no health questions. But after that, you would have to answer health questions to get a Medicare supplement or switch to a different Medicare supplement. Now, your Medicare supplement, you can actually change any time throughout the year. So it does not have to be the enrollment period, October 15th through December 7th. You can change your supplement at any time. The only exception is you have to answer health questions, and the company that you're trying to switch to could come back and say, no, we're not going to accept you, or, well, you applied at $140 a month, and we won't accept you there, but we will take you if you pay $180 a month. So you could be denied or charged a higher rate after that first 6-month period. And like we talked about, the plans are standardized. They're all offered by private insurance companies, but they're federally regulated, and coverage is decided and set across the board by the government and goes according to that chart that we just went over. So like I talked about, Plan G from Company A is the exact same thing as a Plan G from Company A, B, C, D, G, X, Y, Z. They're all 100% identical. And then as far as costs go, the average Plan G is anywhere from $100 to $200 per month, depending on your zip code, your household, and then also your height and weight comes into that as well. And like we talked about, the plans are standardized, but a good independent agent that's contracted with 20 to 25 different companies is ideal. Because what we do is we go put in your age, your zip code, and whether or not you use tobacco, and then it sorts through all of the companies that are available. So that was the Medicare supplements. And then you would also need a prescription drug plan with option 1. And the drug plans are offered by private insurance companies, and Medicare sets guidelines for them of a base plan, and they also have to cover 2 prescriptions from each therapeutic category. And the drug plans, they list out all of the medications that they cover on a list called a formulary. And then drug plans also cover some vaccines that are not covered by Medicare Part B. But on that formulary, on that list of prescriptions, they're tiered out. So Tier 1, Tier 2, Tier 3, Tier 4, and Tier 5. And Tier 1 is your lower cost medications, so it may be a $0 copay or a $2 copay. Tier 2 might be a $5 or $10 copay. Tier 3 might be a percentage or higher. And some of the plans have a deductible. On most of the plans, the deductible is charged by tier. For example, the deductible only applies to Tier 3, 4, and 5. So if you have a generic blood pressure and a generic cholesterol medication that are Tier 1 and Tier 2, you just pay your copay, the deductible doesn't apply. But as soon as you get prescribe something that's more expensive, like a Tier 3 or a Tier 5, then that deductible would come in and apply. And Medicare comes out with a standardized benefit design for the insurance companies. And it's kind of a starting point for the insurance companies that you have to start at this plan. This is a minimum coverage that you have to provide. Now, the insurance companies, if they choose, can offer better coverage than this, but this is the baseline. So the standardized plan for 2025, and there's a new $2,000 cap on the prescriptions for 2025. So starting in 2025, the most that you will spend at the pharmacy is $2,000. So that does not include your premium for your drug plan, but it does include all of your prescription costs at the pharmacy, including your deductible and everything. So the first stage is the deductible stage, and the maximum allowed deductible for 2025 is $590. So if you enrolled in a plan that had this deductible, you would pay 100% until you've met the $590. After you've met that $590 deductible, you would then go into the initial coverage phase. And during this phase, you pay 25%, and your insurance company pays 65 to 75%, and the drug manufacturers give a 10% discount on certain prescriptions. But long story short, you pay 25% up to $2,000. After that $2,000 mark, you then go into the catastrophic phase where you pay $0, your insurance company pays 60%, the government pays 20 to 40%, and the drug manufacturers pay 20% on some prescriptions. But some companies, like for example, there are plans that have no deductible. So, and it's based on the higher of the two, what you actually spent or what you would have spent underneath the standardized benefit design. So let's say that you take Eliquis, which is an expensive medication. It's about $600 a month is the cash retail price. And let's say that you enroll in a plan with no deductible, and let's say your Eliquis is a Tier 3 and a $50 a month copay. Well, the first month that you go get that Eliquis, you just pay $50 for it. Well, underneath the standardized benefit design, you would have paid a $590 deductible. So the $590 goes towards your $2,000 cap. And then after that, under the standardized benefit plan, you would pay 25% or about $175. But under your drug plan, it's just a $50 copay. So $175 goes towards your $2,000 cap instead of just the $50 that you're spending. So what I'm trying to get to here is a lot of people that are on a couple really expensive medications will actually spend less than the $2,000 cap, and the reason is it's based on this standardized benefit plan, and it's the higher of the two that counts towards that $2,000 cap. Also new for 2025 is the Medicare prescription payment plan. So with these new changes, they anticipated that a lot of the drug companies would have the deductible and that they would do just the 25%. Well, if that's the case and you have a couple expensive medications in January and you have a $590 deductible and then you have to pay 25%, your first bill may be $1,200, $1,500. So they created this Medicare prescription payment plan where you can spread the cost of your prescriptions over the course of the calendar year. So, for example, if your pharmacy bill was $1,200 in January, you would pay nothing at the pharmacy, and then your insurance company would send you an invoice each month the rest of the year to spread that $1,200 over the remaining 11 months. So what does a drug plan cost? There's many different drug plans available, and each plan covers different prescriptions at different prices and has different networks with different pharmacies. So shopping by just premium can be costly. Going for just the cheapest plan or the most expensive plan can be costly. Also, if your friend from Kansas City calls you and says, hey, this plan works great for me, unless you guys live in the same area, go to the same pharmacy, and take the same prescriptions, you want to do your own analysis because it's a case-by-case scenario. So what we do is we use a tool like Medicare.gov, and we go put in all your prescriptions, we select your pharmacy, and then compare all of the plans that are available. Like in Kansas this year, there's 15 different drug plans available, and in the surrounding states, it's a very similar number. But that software that we use puts all of those plans in order according to your total out-of-pocket cost, which includes absolutely everything. So it includes your premium, your deductible, your copays, your coinsurances, all of your prescription costs. It says this is what your total number will be for the whole year based on your prescriptions, your pharmacy, and your situation. And then we also have to look out for restrictions. There's 3 different types that the drug company or the insurance company can put on a prescription. The first one is quantity limits. So an insurance company may only cover 30 tablets every 30 days. So if you take that twice a day, that might be an issue, and we might need to do a dosage change and cut it in half, or something might need to be changed. The other thing is prior authorization, which just means that your doctor has to fill out a form saying why it's necessary. And the third and last one is step therapy, where if you're on a brand name prescription, the insurance company may require that you come in and take the generic for 3 months before they'll come in and pay for the brand name. The other thing is the prescriptions can change tiers, the pharmacies can change networks, your plan's premium can change, your drug coverage can change every year. So it's very important to review your plan October 15th through December 7th. And that's something that we do for all of our clients is a complimentary review each year during that October 15th through December 7th timeline to look at any medication changes, to see if the drug plan is changing at all, to see if the pharmacy is still in network, and ensure that they're on the most cost-effective and best-fitting plan for the following year. So some points to remember about prescription drug plans. There are no health questions to enroll. You must enroll during a valid enrollment period, though, like your initial enrollment period when you first turn 65, or the annual enrollment period, October 15th through December 7th each year. And then there's also other special circumstances, like if you're retiring and leaving group coverage, or if you move to a different county and outside of your planned service area, then that would trigger a special enrollment period as well. And unlike the Medicare supplements, where all the plans are the same, the drug plans, all of the plans are 100% different. They're offered by private insurance companies, and like we talked about, they cover different medications, and they may have restrictions. And then also, like we've talked about, there's a network of pharmacies. So Dillon's might be preferred where Walgreens is standard, or whatever the case may be. So it's important to make sure that you're going to a preferred pharmacy, or the pharmacy that you prefer is preferred with your insurance plan. And also, like we talked about, the plans change from year to year. And also, there is a penalty for not enrolling in a drug plan when you're first eligible. So a lot of people say, well, I don't take any prescriptions, I don't need a drug plan, or I take 1 or 2 prescriptions, I'll just pay cash out of pocket for it. You absolutely can do that, but you're incurring a penalty each month that you go without coverage. So it's important to enroll in a drug plan, even if you're not taking any medications, just to avoid the penalty. The other thing is you can only enroll October 15th through December 7th each year, and then at least you have it. And there are drug plans that are very little or low cost, so it's important to enroll in a drug plan even if you're not taking any prescriptions. So here's kind of a higher level overview of option 1. Again, you'd have Medicare Part A and Part B. Part B would be $185 per month. You would also have a Medicare supplement, which would vary based on your age and tobacco and zip code. And then you would also have a prescription drug plan, which would vary based on your prescription costs. So option 1 is a lot higher monthly cost, but lower cost when you use it. And with option 1, original Medicare, you can go to any doctor, any hospital. As long as they take Medicare, they're required to take your supplement. So there is no networks or anything associated with original Medicare and a supplement. If you want to go to MD Anderson or Mayo Clinic or Cleveland Clinic, as long as they take Medicare, which they do, then you're good to go see them. Important note though, option 1, original Medicare, does not include any dental, vision, or hearing. Now, Medicare will pay for vision if it's related to a medical issue. So like glaucoma or cataract surgery or retinopathy, Medicare will pay for those, but they do not pay for your exam where you go do the refraction part and read the lines, and they don't pay for any glasses or hardware. And no dental or hearing with original Medicare either. You can choose to purchase a separate dental or vision plan, but it's not included with original Medicare. So now switching gears to option 2, the Medicare Advantage plans, you would still have Medicare A and B, and you would still have to pay your Medicare Part B premium, the $185 per month. And then you would also have a Medicare Advantage plan. So the Medicare Advantage plans typically include drug coverage and have extra benefits like dental, vision, and hearing. So a little bit of an overview of the Advantage plans. So when you have original Medicare or option 1 and you go to the doctor or hospital, that bill goes directly to Medicare or the government first. And the government or Medicare is processing the bill. The government or Medicare is paying 80% of the bill. They're doing majority of the work. Whereas when you have option 2, a Medicare Advantage plan, the government contracts out all of that to a private insurance company. So they give the insurance company a monthly stipend. They say, here you go, here's X amount of dollars per month. You come up with the plan design, you determine the premium, you determine the deductible, you determine the extra benefits, you come up with all of those things. But here's a baseline of requirements. So Medicare has a baseline of requirements that it has to cover everything that Medicare Part A and Part B would cover. So if cataract surgery is covered under original Medicare, it has to be covered under the Advantage plan. But the Advantage plans, most of them are zero premium, so you don't pay anything monthly for them, but you pay when you use it, very similar to group insurance that you've probably had in the past, where a family doctor might be zero, a specialist might be a $40 copay. If you have surgery, it might be a $500 copay. Everything has a set dollar amount or a set percentage that you pay for it up to a max out of pocket. And the insurance companies have to spend 85% of the money that they receive out on claims. So that's why you see Joe Namath on TV talking about dental, vision, and hearing and this and that and all of those things, is because they have to spend 85% of the money that they receive. So they add these bells and whistles to try to attract more people. So it has to cover everything that Medicare Part A and Part B would, but there's some caveats there. So the first thing is the Advantage plans are either HMOs or PPOs, which are both networks of doctors. We are not as big of fans of HMOs, and the reason is with an HMO, if you go out of network, you have no coverage at all. Whereas with the PPO, if you go out of network, you still have coverage. You just pay more than you would have if you went in network. So the first thing is you want to make sure that your doctors or your surgeon or whatever it is you're having done is in network with your plan, which in your more populated areas, most providers and hospitals are in network, but there are changes from time to time, and it's important to look at all of those and ensure that they are in network before you would go this way. So you have a network. The other thing is the Advantage plans can require prior authorizations. So if you need a back surgery, the Advantage plans are required to fill out a prior authorization, which is just a form that the doctor is required to fill out saying why is this surgery necessary, what has been done beforehand, where original Medicare does not have as many prior authorizations. And then, like we talked about, the Advantage plans typically include additional benefits like $1,000 worth of dental or some dental work, vision, hearing. They may give you money for over-the-counter items. They may pay for a gym membership, or some of those extra benefits are usually included with the Advantage plans and not with original Medicare. So like we've talked about, the cost on the Advantage plans, most of them are zero premium. Some do have a small premium. Like we've talked about, you still have to pay the $185 per month for the Part B. Other than that, if you don't use it, you don't pay anything out of pocket. You pay when you use it in the form of co-pays or co-insurances up to a max out of pocket. So you pay all of those co-pays up to a max. So with the Advantage plans, you at least have a max out of pocket, whereas with original Medicare A and B only, that 20%, there's no cap on that. So some points to remember about Medicare Advantage plans. It's an alternative to the original Medicare A and B route. You're still enrolled in Medicare. You still have to pay your Part B premium, but Medicare is not paying your claims anymore. They're paying an insurance company to handle and pay those claims for them. And something to point out is if you are unsure, you should always do option 1, original Medicare first. And the reason is the Advantage plans have no health questions. So you can always go to an Advantage plan as long as you have a valid enrollment period, because they have no health questions. The government is giving them all of that money, and they say one of the stipulations is you cannot discriminate or ask any health questions at all. So you can always go to an Advantage plan, but remember, to get a Medicare supplement with original Medicare, you have to do it within 6 months of your Part B start date to have no health questions. So what I'm getting at is if you do an Advantage plan, you may not be able to go back to original Medicare if you can't answer the health questions. So if you're unsure or not 100% sure, you should always do option 1 first, because option 2 is always an option, whereas you cannot always go back to original Medicare. But to switch your Advantage plan, it must be done during a valid enrollment period, which would be your initial enrollment period. And then also annual enrollment period is October 15th through December 7th. And then there's also Medicare Advantage open enrollment period, which is January 1st through the end of March. And the Advantage plans can vary from year to year, and that's why they have that open enrollment January through March, because a lot of people say, well, I'm happy with my plan, let's just leave it be, and then after the first of the year they find out that it's changed, so they have another time period there that they can make changes. And all plans are different on the Advantage plans. So they're offered by private insurance companies, and the coverage and costs will vary greatly from plan to plan, and it can change from year to year. And like we talked about, the Advantage plans do have the prior authorizations or more prior authorizations. And then there's also that network of doctors. It's either an HMO or PPO for the most part. And most of the Advantage plans, like we've talked about, include the prescription drug coverage. So a little bit of a recap, like we've talked about, it really comes down to two options. Option one, original Medicare with a supplement and drug plan, which will be low cost when you use it, higher monthly cost or higher premium, but lower cost when you use it. You can go to any doctor you want as long as they take Medicare, no HMO or PPO network. In coverage, for drug coverage, you would need to choose a separate standalone drug plan. So again, higher monthly cost, low cost when you use it, but no dental, vision, hearing, or any of those things with option one. Then the second option, Medicare Advantage plans, are typically lower cost monthly because you just pay your Part B premium and that's all. And most of the time the drug coverage is included with the Advantage plans. And the Advantage plans, like we've talked about, are either HMOs or PPOs. So you have to go to doctors that are in network with the plan. And then as far as costs go when you use it, you have copays and coinsurances up to the max out of pocket. So if you have a bad year, you could have a lot of copays up to the max. Or if you have a really good year and don't go to the doctor at all, you could potentially save all of that money. And again, if you're unsure, you can always go to an Advantage plan, but you cannot always go back to original Medicare. So if you're unsure, do option one first. Feel free to schedule a consultation with us and we can sit down and go over both of these options more in detail according to your doctors, your prescriptions, and your situation. So a little bit about what's next. You guys have handled the first step, getting educated on how Medicare works. The next step is to schedule a consultation with us. It doesn't cost anything for you to get our advice or our help. How we're compensated is we're contracted with all of the insurance companies, and whenever you enroll or we enroll you in that company pays us. And like I've said, we're independent, so we're contracted with all the drug plans that are available in Kansas and about 20 different Medicare supplement companies as well. But what we can do is sit down and help compare your group coverage versus Medicare and whether you should stay on the group or whether you should transfer over to Medicare. We can also help determine when you should start Medicare, help you enroll in Medicare Part A and Part B on time, and make sure to avoid penalties. And then also sit down and go through original Medicare with a supplement and drug plan versus Medicare Advantage plan in your scenario. And like I've said, as independent agents, we evaluate all of your plan options to see which fits your situation the best. So not only are we independent, but also what we do for all of our clients is free lifetime billing and claim service from our client service team. So Kelly and Rashonda at our office, that's their full-time job, is to make sure that your application went through and was received, help with any ID card replacement issues, any claim issues, address changes, benefit questions, anything else. We're here to help throughout the year if anything comes up. Ourselves being the licensed insurance agents, and then also we have a support team that helps us out there. And like I mentioned previously, also something that we do for all of our clients is free annual reviews to make sure that you're on the best suited plan for the following year, just with the drug plans, Advantage plans, everything changing from year to year. It's very important to review it. So appreciate you guys spending your time watching this, and feel free to click that button down there below to schedule a one-on-one consultation. But otherwise, you guys have a great day.